Hi, my name is Reema Hadi. This is the Swan Clinic. Welcome. Now we're going to talk about labiaplasty. Labiaplasty is a really common procedure in our clinic. We've done safely more than 1,000. It's an operation that I hope in a good way has no upkeep. Don't need to come back. It doesn't stop you from having kids. And kind of a revision rate, even long term, is extremely low. And essentially what I do is the wedge technique or the butterfly, where you take a wedge of tissue kind of from the middle, but of course everyone's tailored because your bodies are different. And I think it's a better procedure than the trim. The reason for that is the scar is kind of a thin around the corner in the middle of the labia minora scar. I think the trim can cause scalloping, it can cause irregularity, and it can cause the clitoris and the hood to kind of hang forward, which when you stand in a mirror, you kind of don't want to see that. Whereas the wedge or the labia done in the butterfly technique kind of tucks it all back. It's really important to kind of have a look at before and after photos, and we have so many of those. And I think it's really important to kind of talk to you about what can be achieved and whether this is the right operation for you. Sometimes we combine it with other procedures like the clitoral hood, so just a bit of skin removal, nothing that goes deep, nothing that damages your nerves, I promise. And essentially from the side as well, that's called a lateral hoodectomy. Of course, we always examine the back to make sure there's no polyp or anything that can be checked at the same time there as well. Usually this operation is standalone. We can offer kind of other procedures with that, and that includes a fat graft to labia majora. You can also do a perineal repair for the ladies that have had kids. So I think it's really important to have a look at the area, the vulva in its entirety, to make sure that it doesn't affect don't want to operate on one part and affects the other part, but at the same time, standalone labiaplasty is the most common procedure that we do. Thank you so much for your time.